Now we have a friend, a mentor in this field, and an amazing speaker, Alex Paziotopoulos. Alex is the CEO of the Paziotopoulos Institute. Pay attention, this is really critical for your future. Alex takes a solution-based approach to healing the physical, mental, and emotional health of his patients at the Paziotopoulos Institute in the West Loop neighborhood of Chicago in the United States. As a specialist in anti-aging, regenerative, and functional medicine, Dr. Paziotopoulos incorporates a variety of disciplines into his practice to ensure that individuals, especially those over 50, enjoy a long and happy life. He values building the long-term relationships necessary to co-create a roadmap for longevity and good health. As a fellowship-trained physician, Dr. Paziotopoulos has experience in addressing numerous health issues with the most innovative treatment options. However, he puts focus on the preventive methods available to slow down or even reverse the progress of aging. Dear Alex, join us.
Thank you, Nuno. It's great to be here today. Before I start this, I'd like to just say I've been doing this for about 10 years now, trying to optimize humans. And I'm really excited because over the last 18 months, what I've been putting together is a really amazing board, a scientific board, of which many of the people on that board are speaking here. And the nice thing about having a scientific board is it's not just me making decisions about what we're going to be doing in the future and how we're going to be taking care of patients and the algorithms that we're creating. So the other thing I'd like to say is for all the investors out there, there are some investment opportunities for this new entity that we're putting together. And I think it's really interesting. And we'd also like all the investors to become members. Okay, here's the current state of medicine. And forgive me, I usually speak for about an hour on this. We're going to do this in 15 minutes. So pay attention. Current state of medicine, and we all know this, right? It's problem-focused, and physicians wait for something to happen, and then they try to treat it. This is a terrible way. Engineers never do this, right? We're always reacting to it, and then it's fragmented. If you go see your neurologist and then you go see the dermatologist, they don't talk to each other. And a lot of the times the medicines that they'll be using might be good for that organ, but might not be good for another organ, or might not be good for your mitochondria, and they just don't care. They're focused on whatever they're doing. So medicine, the way we're doing it, it's not great. Now, does ER work? Yes, please go to the ER, right? But for long-term strategies, it's not great. This has been gone over a few times here at this conference, but this leading cause of death, these things should not be happening. If engineers were in charge of these things, these are called single points of failure. The rate of heart disease is so high, and the people that die from heart attacks still is enormous. And the technology we have to detect whether or not you have plaques in your heart is not expensive. And the strategies that we have to slow down that progression and even slightly reverse that are here. Diagnosing cancer, we have AI now that can look at these epigenetic markers that can pick up cancer very early. We have full body MRIs. There's so many things that we can do to prevent a lot of these things from happening. So these are the focus of when we first see a patient, to make sure that we reduce the chances of any of these things happening. When we go to medical school, they teach us, when you write a note, to write down what problem you're dealing with. And they scold us if we try to treat more than one or two problems in a visit. But there's no prevention. And so we just get blinded. And even in functional medicine, people are still focusing on problems. And if you're always focusing on problems, you really can't optimize a system. Look at that. There's 1.7 million cancer diagnoses, right? There's 6 in 10 people have chronic disease. One of the horrible things here is 25% of all healthcare spending is on the last year of your life, which wasted money. They can't do much for you in the last year of your life. So why are we spending 25% of all the money that we can spend in healthcare on those people at that time, right? And then only 3% is in preventative care, right? Now this is fast growing, and hopefully that the investors out there will be looking at this and will want to invest. 3.7 trillion lost in chronic disease, right? So, and the more people with these really advanced chronic disease, they're not producing. None of our diseases exist in isolation, right? And this is just a very small list. If you look at the biochemical reactions there, you've heard speakers here on each one of these subjects, right? It's all interconnected. And so if we focus on optimization and we try to optimize everything on the right there, the chances of the things on the left happening, they just go down. This is what engineers do, right? So whether you're building a bridge, whether you're taking care of an aircraft, a rocket, you have $1 billion satellite, these are the modes you're looking at, right? So FMECA, standard, right? And by looking at that, you're gonna know what can happen to the system, what do you need to do about it, right? Root cause analysis, this is what we're finding out right now, at least in what I'm doing, is that list of all the things that can happen to you from heart attacks to cancer, right? What are those things? What are the risks? What are your specific risks after we do the diagnosis and see where you're at? And then what do we need to do about it? And then the things on the right, condition monitoring and maintenance scheduling, this is massive, right? And we're not animals in cages. And the nice thing about animals in cages is that it's 100% compliance. It's great, right? You never miss a dose. You have the exact amount of calories. You turn the lights off at the right time. You exercise them a certain amount of minutes. Everything's perfect. That doesn't happen with humans. So we have to use other things. This is the human variable, right? Regular maintenance engineering there on the left, and medical maintenance engineering, at least what I call it, on the right. 50% of people are compliant with one medication. Now, think about what we're doing. We're doing human optimization, age reversal. How many different types of variables are we using? Different supplements, different medications, different peptides, lifestyle changes. It's a whole slew of things. So if we're going to be effective, we have to have a completely different system in order to handle all this. Spiritual and psychological health. This is massive, right? And I'm not going to go into all this, but I kind of want to go into one of the members of our advisory board is Dr. Hemal Patel, and he's at University of California, San Diego. And a lot of his work has been focused on what Dr. Joe Dispenza has been doing, which is teaching coherent meditation. And one of the really cool experiments that they did, and this is going to be mind-blowing for you, is they've taken cancer cells in a petri dish, and they let them sit there, and they take people going into coherent meditation around this dish, and those cancer cells start to change back into normal cells, right? Now, this is not, frou-frou. This is in a lab with tenured professors, and it's mind-blowing, right? We measure people's coherence in the clinic. People that are not in coherence, their vagus nerve's not firing right, they don't breathe well, they're in a state of stress. So it's really important to teach this, because if they're not in a state of coherence, or at least if you can't get close to it, you're going to create disease in your body. It's just when. And we can help not only reverse parts of disease by doing this, but we can help prevent it and also increase the quality of your life by reducing your stress and your anxiety. The rest of this, the discovery process, that's what you do when you come in, right? We do all the testing, we go through all your medical records, we do all your exams, we figure out what is going on with you so we know how to change the algorithm for you. Following up, creating all the follow-ups, project management. Without project management, this doesn't work. Project management is not in your regular doctor's office. They don't know anything about it. They don't have a system to do it. Without that, you can't possibly take care of somebody long-term. One quick thing about this before we even get into that, there are a lot of clinics, and I'm not putting any clinics down because I think every clinic that's going into age reversal medicine and is doing a lot of good, but there's a lot of medical theater out there. And what I mean by medical theater is there's a lot of places that are doing all this in-depth testing, but that's it, right? There is no plan of action that's going to take you through the rest of your life. There's no algorithm of what you're going to test, when you're going to test, of what approaches you're going to use, what medications you're going to use, what supplements you're going to use, what peptides you're going to use, what stem cell therapies you're going to use, none of that. So this is how we create and implement the medical maintenance engineering, right? Automaticity versus self-regulation. This is huge, right? If you ask someone to self-regulate by doing this, then, this, then, this, then, it's very, very difficult. You have to try to get this automaticity to work. So in order to get automaticity to work, you have to link things to things that they're already doing. And you need to help encourage them by having follow-ups. So we have health coaches that call these people every week. And we'll go into this, some of the other things that we're doing. If you look at the end there, the prepackaged supplements, it's not just supplements. This is one of the most important things that we've ever done. And I think that it's the only clinic that's ever really done this, because not only does this increase compliance, but what it really does is it ensures that our data is worthwhile. So most physicians, when they're giving a certain medication or they're giving a supplement or they're giving anything, they have no idea if you're actually taking it, right? You have all these bottles, and so you have this, hobby of taking supplements, right? So we prepackage things into 4 doses a day. You have morning fasted, morning with your first meal, last meal, and before bed. Because certain supplements and certain medications are best taken at certain times of the day. All of your medications, all of your supplements in those bags. When they're in those bags, it makes it a lot easier for you to take them, and it's a lot easier for us to track you. And we've been putting money into software so that now with AI, you just take a simple picture of that pack, which is dated for that specific day and that pack, and now that goes into our data lake, and we have compliance data. This is massive. The other thing is that certain medications should only be taken on certain days, like a rapamycin, and certain supplements should be cycled because you get negative feedback. This is only possible with doing it in this way. Here's all the behavior strategies, right? Fasting, diet, exercise, spiritual practice, sleep, breathing. These are all the things that we have to teach people. That's why it's an institute that you have to learn. So I practice martial arts. So I tell people, like, you come in, you're a white belt. And as you keep learning, you go up. Psychological health. We'll go through this more, but this is more about why you need a spiritual practice in your life. Here's all the strategies that you're going through. Sorry? I'm sorry, we have very few minutes. You'll be able to get this later from Nuno. You've heard of all these things. Therapeutic plasma exchange. We're in an IRB now to actually give you young plasma. Repurposed pharmaceuticals, coherence training, supplements, IVs, peptides. So much great new information and new data with ketamine psychotherapy along with transcranial magnetic stim, really helping people with chronic depression and anxiety. Genetic therapy, new genetic therapies happening now. that are a lot less costly than it used to be. It used to be like almost $1 million. Now it's becoming a lot more affordable. And definitely hormones. Without hormones, people just don't get better. This is fragmented medicine. See all those specialties on the right? You don't need that. You need one place that's going to really take care of you. Not that you're not going to go to specialists, but you need someone that's going to call the shots of what that specialist is going to do for you and how they're going to do it. Here's all these AIs, right? Here's these different tests. The Clearly Heart test, fantastic. Full body MRI is fantastic, right? These new cancer tests, fantastic. But they're all separate AIs that don't talk to each other. We need to have a central AI. And we have one. We've been training it. It has a huge data lake. Without that, we couldn't do this. This is a fragmented industry right now. So there's clinics, there's your EMR, which is your medical records, right? You have administration apps. You have people with their Aura Ring and their other data, right? And then you have different trainings. People go and get different functional medicine trainings and things like that. It's all fragmented. It doesn't work together. And then you got AI sitting over on the side here. We need to bring all of this together. And that's what the Institute for Medical Maintenance Engineering is planning to do. Right? It's an integrated solution. Excuse me for going so fast. But you see how we're going to have conferences, right? And training and accreditation and membership models. Without membership models, people fall off. They need to be a part of something. They need to pay a monthly membership so that they know, like, I'm going to keep going and I'm going to keep getting these things. It's not just for a year. What's 1 year out of a 100-year lifespan? It's not going to do much for you. You have to do this for life. This is just the system that we use. I'm sorry to blow through this, but and here's how you need to have something wearable and you need to have something in your hand that's going to help you get through your day. And you need to have a dashboard so you can see all the systems of your body and where you're at. 30% of healthcare is wasted on administration, right? Not only that, like in my clinic, like if you buy wholesale supplements, they're really expensive because you're paying for all of these people that run these supplement companies and what they're doing over there. So with better buying power, we'll make our own supplements. With better buying power, we get a hold of pharmaceuticals. The IMME has the chance to not only provide you with, amazing care, but decrease costs. We need to train more physicians to be medical maintenance engineers. And by doing this, they don't have to set up their own box. Physicians are terrible at medicine. I mean, not terrible at medicine. They're terrible at business, right? They're terrible at medicine sometimes. But they're terrible at business. So we need to be able to create a platform for them so that, they don't have to worry about the supplements. They don't have to worry about where the medicines are coming from, the compounds, all that kind of stuff. They can just do their job. So this is where we're at, right? So if you're interested, you can scan that and you can find out how to be a member. You can reach out to me for any other questions. I know it was quick, I know it was dirty. I'm happy to answer any questions, but I really feel that this is the way to move forward. And, we've had 10 years now and, so many case studies where we've, shown reversal in glycans, reversal in epigenetics, lengthening of critically short telomeres, just people feeling robust, symptomatically just feeling so much better, and just changing their lives. Thank you.
Thank you, my friend. Thank you, absolutely brilliant as always. Thank you so much.